Oh man, I was just talking to the doc here, Dr. Joe. Ngimbuza ukuthi uyakhuluma isiNdebele, doctor? Uyakhuluma?
Yebo
Okwamaqini?
okwamaqini sibili. Ngilindebele
So
qho.
i-interview le sikhuluma ngokwe-stroke sizakhuluma ngesiNdebele.
Akulankinga.
Okay.
Yebo.
For those that won't understand, I'm sorry. Well, today is World Stroke Day, so that's why we have you with us, Dr. Joe. Thank you so much for coming.
The pleasure is mine, Val.
Especially on Wellness Wednesday on The Big Show, we try to make sure we equip our listeners with the right information. And it being World Stroke Day, I spoke about it just before the doc came through. I just want to give you a brief history of World Stroke Day. Statistics have shown that 1 in 6 deaths due to cardiovascular issues are related to stroke. And stroke is a leading cause of serious long-term disability. And since stroke is a preventable and treatable disease, this does not have to be grim news, but should act as an encouragement for people to pay more attention to their health. And that's what World Stroke Day is all about. Established in 2006 by the World Stroke Organization, World Stroke Day is an annual event that emphasizes testing, education, and initiatives to improve and mitigate the damaging impact that stroke can have on people's lives worldwide. So now we get to hear from the expert, Dr. Joe. To start off, what exactly is stroke and what happens in the body when someone has one?
Thank you so much, Val, for the question. So, stroke simply means, in medical terms, actually it's not simple, it's a complicated term.
Okay.
In medical terms, we call it a cerebrovascular accident. But I need you to understand this term so that you can understand what exactly happens with the stroke.
Okay.
So we call it a cerebrovascular accident. If you remember the cerebral hemisphere, that's the brain. So cerebral simply means to do with the brain.
Yes.
Vascular arteries. So the cerebrovascular arteries in the brain. Accident. That's the most important word. So that means there is an accident that has happened within the arteries in the brain. That's a cerebrovascular accident. So if you understand this term, cerebrovascular accident, now you understand strokes better.
Okay.
So what simply means, what happens with the stroke, mainly it's two types. Either we call it an ischemic or a hemorrhagic stroke. Ischemic means the accident has been caused by a blockage. There's something that has blocked the arteries to the brain. Then that is going to cause challenges with symptoms that we're going to talk about later on. Then the second one is hemorrhagic. That means there's a bleed that happens in the brain. So I always give this analog or this simile. It's just like main cause of stroke is high blood pressure. That's one of the main causes. So what happens is that the pressure with which blood is moving within the blood vessels is just similar to the speed with which a car is moving in the roads. So if the blood pressure is high, it's just the same as a car that is speeding on our roads. So if the blood pressure is high, chances of an accident happening in the brain are higher, just like the chance of you having an accident if you're speeding on the roads.
Right. That makes a lot of sense.
You get it.
Now, Doc, I wanna bring this to I wanna highlight a personal issue. This actually hits home for me because I've got a sekuru who was hit by a stroke.
So
and
sorry.
when I was reading the stats, it was saying it mostly hits people that are above 65. I think older people. And my sekuru is 50, and I also have a cousin who went through that, and she's 36.
Yeah.
So I mean, so in terms of age, like what's happening here?
Yeah, generally strokes generally affects the elderly more than the young guys.
Okay.
Mainly because as you get older, chance of suffering from high blood pressure, diabetes, which are the high risk factors for strokes, are higher. Mainly because your arteries are becoming stiff with age. Now blood pressure goes up. Then definitely chance of suffering from strokes are high. But we're getting more cases of young individuals with hypertension and young individuals with complications. Like actually just before I got into the show, the last chat that I was attending to is a friend of mine with hypertension, and he's been exercising a lot and he's still young. And his BPs were going all the way to up to about 180. So he's now a high-risk individual. So even if you're young, if you've got high blood pressure, if you're not taking medication, your chance of getting a stroke are still high as someone who's actually old. So the main risk factor is hypertension, not necessarily age. If you are having hypertension and it's untreated, because I have these issues whereby someone will say, Doc, I'm too young, how can I be on medication for hypertension when I'm this young? But it doesn't matter. If you're hypertensive, whether you're young or old, you still have to be on medication to avoid the chance of suffering from strokes.
Man, so what are the main causes of stroke? Because I think people just assume it's stress, stress, or stroke.
Thank you for bringing that up. Stress does not cause strokes. That's not true. Social stresses,
especially
it doesn't cause stresses. It might cause other issues, but not strokes.
Okay.
Yes. So high blood pressure is not caused by stress, social stresses. High blood pressure is mainly caused by our habits, the lifestyle that we live. The number one, people lead a sedentary lifestyle. You don't exercise, you just eat a lot of fatty foods, a lot of salt, take a lot of salt. Those are the high risk individuals for suffering from hypertension. So once you've got hypertension, now the risk for strokes are high. If you're diabetic, the risk for diabetes are still the same. Not exercising, eating plenty of fatty foods, leading a sedentary lifestyle, then you've got diabetes, and the chance of suffering from a stroke also increase. So these are the main risk factors.
All right.
Yes. So those are the main causes of someone to suffer from a stroke. So high blood pressure, you're not taking your medication, and usually with high blood pressure, at times there is also a poor blood flow in the heart, within the ventricles. Then there are clots that form within the ventricles. So these clots can be dislodged from the heart through the arteries and all the way to the brain. Then the arteries in the brain are now smaller than the other larger arteries from the heart. So this clot that had navigated its way from the heart through the major vessels can no longer navigate across a small, narrow artery in the brain. Then it blocks that artery. So the side that is blocked, there's reduced or no blood supply to the brain on that part of the body. It's just a few minutes of not receiving blood, and then a stroke kicks in. So essentially that's what happens. And then the second thing is the pressure with which the blood is moving is very high, and the arteries are stiff. So the blood will fail to negotiate a curve, just like a car will fail to negotiate a curve when it's speeding. Then that artery will rupture in the brain, then you get a hemorrhagic stroke. These ones are generally more severe and more detrimental. I actually lost a young colleague doctor about a week or so ago from a similar hemorrhagic stroke. So these are the main causes of stroke. So lifestyle, one. Two, not taking your medication if you are diagnosed. Once you are diagnosed with hypertension, regardless of your age, please take your medication, start exercising, and also be on the proper diet.
All right, so you heard it from the doc, but we're going to definitely hear more from him when we come back on Wellness Wednesdays on The Big Show. Come through on 0772168045 if you have any questions for Dr. Joe concerning stroke, because I know a lot of people can relate. Maybe it's happened to someone you know, or maybe you want to have better health so that you don't find yourself in that situation. So definitely come through right here on The Big Show. Welcome back. We are with Dr. Joe with us here in studio on Wellness Wednesdays on The Big Show. And today is World Stroke Day, the 29th of October, and which is why we have an expert with us to tell us about strokes and how they occur and how they can be prevented. What are some of the warning signs, Doc, that someone may be experiencing a stroke?
Generally, strokes don't give warnings. They don't knock or tell you that, hey, I'm about to come. They just hit you like that.
Okay.
So the most important thing is to look out for the risk factors. So number one, always get checked for blood pressure, which is the commonest cause. Get checked for diabetes mellitus. At least once a year, go for diabetes screening, go for your medical checkup, get your blood pressure checked. If your blood pressure is now high, those are the risk factors. Those are the things that you need to look at. Yes, a few people might have what is called a transient ischemic attack, but it's just a few people. TIA, transient ischemic attack, it's a form of a temporary stroke. You just get this weakness that happens. Maybe it lasts for a few minutes to a couple of hours, then it goes away. That's the only warning that people get, but not everyone. Just a few individuals get that. It happens, you're just weak one side, then you recover normally. Normally the blockage was just temporary, then it's relieved, and then you go back to normal. If you see that happening to you, if you've had a TIA, you should thank God and you should be on medication and make sure your BP is all controlled. It means you're at a higher risk of eventually suffering from a cerebrovascular accident, from a stroke. But other than that, there are no obvious risk factors. You can't say I'm feeling tingling sensation, so I'm about to have a stroke, I've got a headache, so I have a stroke. It doesn't necessarily follow. You can have a tingling sensation and never have a stroke. You might have headaches, dizziness, blurred vision, and never have strokes. But when the stroke comes, you won't know. And people always think that, yes, I'm hypertensive, but mine is not that bad. I won't have a stroke. It's the next guy who have a stroke.
Right.
It doesn't necessarily follow. I've had people with strokes with mild hypertension. Mild hypertension, systolics maybe around 150s, then they have a stroke. So the best thing for you to do is to make sure you take your medication religiously, make sure your blood pressure is well controlled. That's the only way you can fireproof yourself against a stroke.
Right. Talking about tingling sensations, and someone will assume that they might have a stroke. A listener is coming through and they're asking, can cramps be associated with stroke?
Not necessarily. Cramps simply means your muscles are not getting adequate oxygen. usually, and now you're having accumulation of lactic acid. That's the reason why people get cramps, not necessarily stroke. Having cramps here and there does not necessarily mean that you're going to have a stroke. So like I said, I will re-emphasize, strokes generally don't have a warning sign.
Okay.
You can tell that this one is going through this, so they might have a stroke.
Okay.
It doesn't follow.
All right.
Yes.
So that's an answer to another listener who's saying kochiveve ne stroke zvinofambidzana here.
Yeah, not
That's
necessarily,
the
but
answer.
yes, chiveve.
Eh.
Chinokwanisa kukonzwa hypertension, BP.
Oh.
Chinokwanisa kukonzwa chiveve. If your blood pressure is too high, it can affect nerves, peripheral nerves. Then chiveve, it's a sign of what is called peripheral neuropathy. My nerves are affected, they don't have enough oxygen, not enough food. Now I get chiveve, tingling sensation, at times burning sensation. That moves hand in hand with hypertension. And as we said earlier on, hypertension is the number one risk cause for strokes.
Right.
Yes,
Okay.
so in that note, yes, it might be, but not necessarily can a stroke.
All right.
But it might mean your BP is not well controlled. You need to manage it.
All right. There's an acronym that's called FAST. I don't know if you know about it. In stroke awareness. Thank you for knowing about it, because it's going to be a very awkward moment right now. If you're going to say as a doctor, I don't know it. Could you please break that down for us, for our listeners?
So first simply means that I'm forgetting the F now.
It's fine. You can start from the A.
So you need to examine the one. You need to be thorough about suspect that you might suffer from a stroke.
Okay.
When you suspect that you might suffer from a stroke, make sure that you always get tested, get checked. That's the S, so that you are sure that your vitals are in place. Then T, I know it stands for treatment. You need to be treated as soon as possible. Once you've got a stroke, make sure you rush for treatment and get your medication as soon as possible. Don't delay.
Okay.
I've got cases whereby someone has a stroke and people delay. They take them to Sangomas or anything like that.
Yeah.
Then by the time they get to the hospital, it's too late. Some of these strokes, and also the other thing with a stroke, you might get one stroke that might seem mild and you don't get treatment. You might also get another stroke. I've had patients that had a stroke within 24 hours of another stroke. Yes.
That
So
is
please make sure
scary.
you get treatment as soon as possible. Let's stabilize the blood pressure. If the blood sugars are high, let's also stabilize the blood sugars so that you don't get another incident within a short space of time.
All right, so let's talk prevention and lifestyle. All right, what
Yes.
what advice can you give us in terms of lifestyle? What should we do so that we don't fall prey to strokes?
So number one, in terms of lifestyle and prevention, exercise.
Okay.
Is the most
It's
important
number
thing.
one.
Number one, to me, exercise is number one. You need to exercise. You can't just say, I'm young, I don't do anything. You need to exercise.
That's what we say.
And you can't say, I don't have money to go to the gym, which is one of the silliest excuses
It's
that
so
I always
silly.
get.
You can run, you can do
Yes,
whatever.
everyone
Yes.
has got some a pair of sneakers
Yes,
or something,
yes.
trainers. Just get into the streets and jog. So you need to exercise. Normally, we say 30 minutes minimum twice a week.
That's good.
That should be enough.
That's good.
If you're not hypertensive or you don't have any risk factors. But if you're hypertensive, you're diabetic, you already have risk factors, you need to do more, maybe 30 minutes 4 times a week or even every day. 30 minutes exercise. So encourage cardiac exercises. That is cycling, jogging, skipping, swimming. Those are things that we encourage. Less of bodybuilding, lifting weights and building your muscles is not good for your heart as well. So that's first thing, exercise. And then second thing is diet. So diet, please make sure you don't eat a lot of fatty foods, cut on takeaways. Then also salt. Salt is a big risk
Salt.
factor. So I know of people that just eat salt as soon as they see their food on the table.
Yes.
So please make sure you don't add salt. Cooked salt is better. So when you cook, just put a little bit of salt. Never add extra salt after cooking. So if you do those two, then the third thing, always get checked. That
I was
we
about to
can't-
ask, are there any
yes.
screenings or checkups that we can do regularly?
Yes, at least once a year, go to your doctor, to
Okay.
a clinic, to a hospital.
Yeah.
Just ask them to check your blood pressure, blood sugar levels. Those things are going to help you.
Right.
So it's always very important for you to get checked. Then lastly, once you're diagnosed of hypertension or diabetes mellitus or any condition that is a pre-risk factor for stroke, make sure that you take your medication religiously and make sure you continue. Now, if you're diagnosed, there is no way you can go for more than a month without having your BP checked. When you're taking your medication, you can't say, I'm taking my medication, so I'm now okay. No, BP does not stop attacking you because you're taking your medication.
Right.
You need to take your medication and get it checked at least once a month. And nowadays, I encourage you to buy these machines are now fairly affordable, $10, $20.
Yes, they are.
So you can buy your
And
machine,
accessible.
check yourself at home every now and then. So if you do that, you minimize the chance of suffering from a stroke.
Okay, Doc. In closing, for people that are experiencing this, how best can they support someone who's in this situation, communities and families, and also what advice would you have to Zimbabweans on World Stroke Day?
Yeah, so everybody is essentially affected to some extent. Like you said, your uncle had a stroke. I
Yes.
also had an uncle who had a stroke.
Oh, shame.
So I'm sure someone has a relative or a friend or someone that they know that they had strokes. So number one, strokes, they are not curable. Essentially, there is no drug that we give to treat a stroke. Yes, there are drugs that help alleviate. You can dilute, diffuse the clots. You can lower down the blood pressure. But once the stroke incident has happened, the cerebrovascular accident has happened, there is nothing that we can do to reverse that. So the next most important thing is physiotherapy. So physiotherapy is what is going to help you regain function, because the idea or the plan or the target of treating someone with a stroke is to make sure that they are self-reliant. You want someone with a stroke to be bedridden, they can't do anything. So I want you to learn to eventually be able to write again, to walk, to talk. Some strokes can affect, especially if it's the left side stroke, it will affect your brain in such a way that you can't be able to talk. So speech therapy might also be needed, physiotherapy, occupational therapy. All these forms of therapy, they are very, very necessary. So please support your relatives with a stroke by make sure that they go through this. If finances are limited in terms of
Yes.
physiotherapy, you can talk to these physiotherapists. They can also teach you some of the things that you can do at home
Okay.
on your own, and also encourage the patient to be positive, and also it will take a toll on your mental health. Imagine you used to go to work, now you're just bedridden at home, so you're going to have mental health issues. So you need counseling and family support. So those things are very important in terms of managing the outcomes of strokes.
Wow, thank you so much, Dr. Joe. It's always a pleasure having you. And thank you for being with us here on World Stroke Day on Wellness Wednesdays on The Big Show. Much appreciation.
The pleasure is mine, Aval.
24/7